Hello everyone, I hope you all are fine. In today's video, we will discuss the skull bone, sutures and paranasal sinuses. If you are new to this CT Brain series, I suggest you to watch the previous videos for proper and better understanding. My name is Dr. Talha. Let's learn together about the skull bone, sutures and paranasal sinuses. In this video, we will discuss the ones that are related to the CT scan series. This here is the frontal bone, this is the parietal bone, this one is the ethmoid, this is sphenoid bone, and the one here is the temporal bone. This one is the occipital bone. These skull bones are divided into outer table and inner table. As you can see on your screen, in between these bones are the fibrous bands of connective tissues which are known as sutures. These sutures connect the skull bones. There are mainly four sutures named as coronal, sagittal, lambdoid and the squamosal suture. This is the sagittal suture uniting two parietal bones in the midline. This is the coronal suture. It unites the frontal bone with the parietal bones as you can see. This one is the lambdoid suture. It unites parietal bone with occipital bones. This here is the squamous suture uniting squamous part of temporal bone with the parietal bones. This is a simplified lateral view of the sutures and the skull bone for your better understanding. This here is the superior view. This part is the pterion where frontal, parietal, temporal and the sphenoid bones unite. It is the thinnest part of the skull and behind it runs the middle meningeal artery. You must have seen it in the movies or TV shows that people who attempt suicide usually point their guns at this point. In these bones are the air-filled spaces in the skull named as sinuses, aka paranasal sinuses. They secrete mucus to protect against infection and humidify the air. They also serve to decrease the weight of the skull and increase the resonance of the voice. They provide protection to the vital structures in case of any facial trauma. And more importantly, when visualizing a CT scan, these sinuses act as landmarks. This one here is the frontal sinus lying in the frontal bone. As we scroll down towards the nasal cavity, this here is the ethmoid bone. And these black structures are the ethmoid air cells lying medial to the orbit and superior to the nasal cavity. At this level here, you can see the maxillary sinus lying just lateral to the nasal cavity in the maxillary bones. Scrolling down further, this here is the sphenoidal sinus lying in the sphenoid bone. This part here is the petrous part of temporal bone. And these air-filled spaces in the temporal bone are mastoid air cells. You can visualize various diseases affecting the mucosa and bony cavity of the paranasal sinuses on a special CT scan known as CT-PNS view. And this scan is very important for specialties like ENT, where FES has empowered most surgeons to treat their patients more effectively without major morbidity and complication. FES is an acronym for Functional Endoscopic Sinus Surgery. So this was all about the skull bones, sutures and the paranasal sinuses. I hope this video was helpful for you. If you have any queries, let me know in the comment sections. In the next video, we will discuss skull base anatomy on CT scan. Thank you so much.